There are two different kinds of tightness. We use this word for all kinds of things, but there's actually only two different kinds of tightness. There's motion tight and there's tension tight. Motion tight means that a muscle will not let you go any further. So if we're going to use this muscle, because everyone has tension in their upper trapezius muscle, we're going to use this muscle as an example. Motion tight would mean that you try to move your head to the side and you can't quite get it to move because the muscle won't let you move. It would be like when you go to do a stretch, if you can't get to about 45 degrees here, that would be an indicator that that muscle is motion tight. It's not letting you move. Now, let's say, like in my example, I can get my head to go 45 degrees and it can move. It has good motion. So it's not motion tight, right? This muscle is not motion tight. It's letting me move. Now, if I go to touch it and I feel that it's holding tension, it's not relaxed, especially if I were to lie down on the mat and I can push on it and it feels like tight, or it's like, you know, almost like a knot in there. It's not soft and supple. That's tension tight. So a muscle can have full motion and still have tension tightness. So when you're addressing these two things, if you want more motion tightness, you do stretches, right? That trains your brain to let that muscle elongate to its full range of motion. But if you have tension tightness, stretching is not going to work. You need pressure. So that's where tools like the ball, the hip hook, different, apparatuses that put pressure on the muscle helps that muscle to relax its tension or its stiffness, and then allows for the brain to get used to not holding that tension, which then changes that pattern. Now, as a practitioner or as a person just trying to take care of their body, it's important to distinguish the difference between motion tight and tension tight when we're talking about muscles. Another perfect example of this would be, let's say, hip flexor tension. If you have tension in your iliacus or your psoas muscle, you may think, well, I should just do a lunge stretch. I'm going to do this lunge stretch. I'm going to open up this muscle and try to get less tightness, right? You could go and have the deepest lunge stretch with the most perfect form and have this area be so open, have a negative Thomas test, have all kinds of just open hips and have a ton of motion, which means that you are not motion tight. But then if you lie down on your back and you press on that muscle when you're completely relaxed, not doing anything, there could be tension or stiffness there. And that kind of tension resolves itself with prolonged pressure. That's one of the reasons why I created the hip hook, because people were having so much difficulty with tension tightness, because it's the tension tightness that gnaws at you. It's like pulling on you. It's like the thing that feels like achy and that's pulling on your bones and not letting your body function as it's intended to.